Working with sciatica with the Heskiers Method and the Heskiers OneTool. You're going to work with the large interstitial fluid curve, and you're going to work with the index finger protrusion. And once, as you see, the patient is standing, is because then the muscles will be easy accessible. But that means that you have to counter press the pressure that you're giving with the tool. We're going to work from the sacrum down over the buttock down to the curve down here. We have the piriformis here, and once you go in here, you notice that I'm working through the textile. I don't need to have the bare skin. I can work through textile. I can work through even jeans. Notice when you're in there, you're not going to wiggle. That would be too strenuous to the tissue and create more trauma than good. So you want to just sink in there and do your manipulation. Now, starting from the sacrum, and you can just go down following the sciatica nerve. And once you come down to the piriformis, you can sink in. My hand is a little out of bounds to show it to you, but because I would have my hand like this, and I would go in like this, and then do my manipulation, the twist for the micromyofascial release in the piriformis. But to show you what it is, I'm holding it so you can see what I'm doing. I counter hold to keep the balance of the patient. I sink in to the piriformis and stay in there, completely quiet, just letting the ergonomic of the tool help me doing my work. Once I feel that I want to do something in there, I'm just twisting the tool to make a micromyofascial release. As I naturally want to work with the piriformis and go on to the next point, I'm not going to move it in there. I'm actually withdraw myself, move a little to the side, and go in and repeat the procedure and do the release. And again, I'm going to do the same and do the release. Now, procedure is that you open the tissue with the interstitial fluid curve. You make the manipulation with the protrusion, and then you disperse the released material again with the interstitial fluid curve. Once that is done, you want to go on to the next point here, and the edge of the buttock, you have on the middle here, you have a point, gallbladder point. Here you will be able to address the point, and you will have a little tenderness from the patient, but you just adjust it. You don't have to make the patient feel the tender. You can just adjust it, that you're addressing the point, subtle, that you can make the manipulation. Again, remember to disperse the material afterwards, once you have released it. Together with these 2 points, and you're working with the interstitial fluid curve all the way down the leg, that helps releasing the tissue, that the nerve is not in such a tight spot. There is a point down on the heel that will be showed in a small video just after this one. That is a good combination point. I can show on my hand, I can show where it will be. It will be here on the heel. This is how to work very simple, interdisciplinary, with the sciatica, with the Heskiers Method and the Heskiers OneTool.